when you are, evaluating a boy like this, I mean, I'm assuming you've probably been in this scenario of having been referred a boy who presented with diarrhea and high LFTs.
Yes, Craig. So when we see this high LFTs, right, ASTs and ALTs, and if you see a boy with developmental delay, the one key thing that I always tell my residents, my colleagues, pediatricians, is to check for creatinine kinase, which is a serum creatinine kinase, as you know, that's highly elevated in these boys. I'm talking about, 10,000s, 15,000s in these boys. So nothing else in these kids with developmental delay cause that high CK other than Duchenne muscular dystrophy. So it is always key when you check AST and ALT, and this is slightly high in boys with developmental delay, check CK. And I think that gives you a diagnosis. Or at least if you do that, then the pediatricians can refer them to neurologists before they end up with other specialists. As you know, these boys can end up with GI doctors or hepatologists, and they may end up getting liver biopsies. Even still these days, we see that. So I think, but CK is a simple test. So if you see, or, pediatricians, if you see a kid with developmental delay, with cognitive issues, speech issues, especially a boy, along with your routine workup that you do in clinic, check a CK level, and that will help you a lot. And that'll help with early diagnosis of these boys.
Yeah, Aravind, I couldn't agree more. A lot of the children that I've seen, you're exactly right. They come to me at being referred at around age 3 or 4, but almost always the parents of these boys have noticed problems earlier than that, and they've brought them to be evaluated. Many of them have been in physical therapy for their sort of mild developmental delay. And you get the sense that there's almost a missed opportunity to check a CK, as part of the thought process when you see a boy who isn't walking on time. I think the speech delay, we see that a lot in our boys with muscular dystrophy, with Duchenne muscular dystrophy. And I think that makes it hard for the pediatrician to identify this as a muscle disease. I think it gets lumped into that category of non-specific mild developmental delay. The kids at those young ages, they don't regress. They gain skill at age 2 and 3. And I think most pediatricians are content and comfortable with that. But in these boys, it's a lot more than just run-of-the-mill developmental delay. It's Duchenne muscular dystrophy. And that's why I think it gets missed a lot.
I agree. No, in medical school, right? It's all, when we think about Duchenne, it's a muscle disease, and people don't think about global delays or speech delays. So I think it's all even safer to save anybody that you see with global developmental delay at what point of, doesn't matter, 18 months or 2 years, 3 years, just get a CK because it's cheap and it's easily done.